Hey, Dr. Hanna, how are you?
Hi, Kyle. How are you?
Very
It's,
well.
things are going, right? Things are
They
going.
they are going indeed.
So I was thinking, Kyle, about the continued situation we're in, and one of the things that keep coming across, and I kind of wanted to get your reaction to it, is there's a tremendous amount of concern that social isolation is going to lead to increasing numbers of people struggling with depression.
Mm.
So, and I think that I can attest to that in my interactions with my own patients over the last 2 weeks, that I have seen that very thing start happening, including in the kids that I see. So it's not just the adults like I was noticing a couple of weeks ago. I've started noticing that the kids, the teenagers, the college kids are starting to struggle with that, including, which is I think is significant, including people who've not actually struggled with depression before.
Mm.
And it's not a, by the way, when I'm using the word depression, I'm not using it in a clinical sense that it's a major depressive disorder and clinical, but of just being sad and down and not being motivated and kind of, thinking negatively about things. So wanted to get your reaction to that and what your thoughts are, and what are some things, maybe some insights that you can share that will encourage people, and kind of give them some tips a little bit.
Yeah, certainly. So I think the first thing that comes to mind is my most recent interactions this week with a few of my adolescent patients. And they've definitely identified with great insight and awareness that they are feeling more depressed. And like you said, I don't necessarily categorize it as this clinical depression, because not all of them have historically presented with depressive symptoms, but are sad, are bummed, are feeling like they're missing out. But what I will say, the common thread that I'm seeing, or the common theme, is that it's a lot of projections about the unknown and the
Mm,
uncertainty of when
yeah.
things will return to normal.
Yep.
And I get that. I really can
Mm,
resonate with that, I should say. And I think it's this idea that I don't like necessarily where I'm at compared to where I was. And if this continues, it's probably going to be so much worse. My loneliness is going to get worse. My my sense of disconnect, even though I'm speaking to you right now, not being able to high five, shoot hoops, do something like that, it's taking its toll. And I think there's a perception or a belief that it's only going to intensify and get worse. And I think that's the first thing that I would point out, is that I think for many, it's that unknown, the anxiousness of the unknown, and when things will begin to taper off and return to normalcy, right? That word that we keep hearing, like, what is normal? What will the new normal be? And I think it's just the lack of an endpoint is causing this pervasive sadness. So that's probably the first thing that I would point out.
mhm. Okay. What are just kind of going off that, knowing, and recognizing what is probably driving this. So what can people do? What are some suggestions you have? Kind of some tips for some people to kind of consider.
Hmm. Okay. So some of these things may be a little not controversial, but you have to hear me out and hear my
Mhm.
intention behind my wording. So social distancing doesn't mean isolated, holed up in a house, in a room with no fresh air, no activity, no involvement whatsoever. And what I mean by that is that whether I'm looking at the adolescents who have played constant video games and are interacting with their peers in a setting, over various, FaceTime and Discord and all these different means, they're still feeling lonely. They're still feeling disconnected. I'm saying to uh, some of those patients that I have, like, how about you call up a friend and carefully, socially distance, go for a run, go for a bike ride, go for a walk around a downtown area. Just get out and talk and converse. And again, I'm making sure that I recommend, masking up and being like truly careful, not playing basketball, not touching any common objects. So I'm trying to give the best safety recommendations, but at the same time, try to get some of these normal routines. So what do you miss most? I miss going downtown and hanging out with my friends. It's like, okay, well, I can't necessarily say that you should do the exact same thing, but
Right.
can we get close while also respecting, the council and the, the safety recommendations that are coming from our state and local governments. And, so that's the first thing. Like, get outside, try to do something that's different, a departure from what has been going on. Because the reality is, Dr. Hanna, that a lot of our adolescent patients have been, I'm thinking adolescent boys, they've just been stuck at home and they haven't moved from, their room, their basement, their, hangout area, kitchen in like 4 weeks.
Yeah.
And I think that has a psychological toll, and I want to break that pattern. That would be my first.
Listen,
tip.
I think that's a great tip. And I've heard of some families that are doing things like that. I heard of a family that was telling me a story of with their neighbors, I guess, next door neighbors, that they kind of did it across a fence, kind of,
Yep.
In their backyard, where I think it's two kids who are around the same age, and they were actually way more than 6 feet apart. But it's a way to socialize, and I do think there needs to be some creativity, because we're created as relational beings. That's what we are. We are relational beings, and I think God made us that way. And isolation and even doing just this, the technology is not enough.
It's not.
So I think that's a great suggestion, and I think that can be helpful to people to kind of not be afraid to kind of explore creatively what are some ways they can connect with people.
Yep.
So thank you for that.
Absolutely.